So I wanted to talk with you guys about considerations for returning to work in this coronavirus era. And when I say return to work, I don't just mean, going to the office or getting back to work. What I really mean is, opening your doors again, whatever that means, both to your workforce, but also to the public and the visitors that you serve, because I think that's just as important. And I think a piece that's kind of being forgotten by employers as they're, rushing to get their doors open. So today, I kind of tried to break it down into a 3-step process for you guys. So first, I want to talk about just kind of circling the wagons and preparing to open the doors. Then we'll switch over to being back to work and what that means, and actually opening the doors. And then step 3, where some of you may have been, hopefully not, but it's happening. I'm dealing with this the most right now, but how we deal with when, and it is when, it's not if, when we deal with exposure or potential exposure in the workplace. So like I said, it's bound to happen. So if you get step 1 and step 2 down, step 3 hopefully should be a breeze. So, this is not your new legislation coming out. COVID is something that you really need to be prepared for. I'm sure you know that. I'm sure most of you are probably in the healthcare field, so you could probably quote health and safety guidelines to me, but you really need to have a solid plan before you start operating in person. And this is not one of those ready, fire, aim situations. This is ready, aim. Are you sure you're ready? Re-aim, then fire situations. So, when we're thinking about getting back to work, the first thing you need to do, I'm sure you know this, is you need to create a plan. How are we going to bring both our employees and our visitors back to work safely? You need to have that plan in place before you open the doors. If you don't, and you already did open your doors, that's okay. We'll get through it. You're going to make a plan now. So what you want to be thinking about is, who can come back? Again, not just your employees, but also, your visitors, who can or would be able to safely engage in the workplace, and who can or is able to engage remotely. Whether you're seeing your patients remotely, is it something where an employee could engage in telework without interrupting the services you're providing. You really need to be thinking about, when you're coming up with your plan, you really need to think about allowing remote work. I know a lot of employers that I have dealt with, employers I've worked for in the past, have not felt comfortable with remote work. And this is kind of a soul searching moment for employers across the country. You really need to consider allowing it, and you need to have a good reason if you can't. If it's just a matter of micromanagement and oversight, you may have to really change your position, because if you can keep your employees safe by allowing telework, you're going to need to consider it, and you're going to have a plan for it, because you can't just say, okay, let's have everybody work on the same system at once. I was talking to Allison before this started. They were asking, are you back in the office? And I was explaining how my firm has staggered time. So most people are doing some sort of hybrid, working remotely, and then staggering visits on alternative work days. You really need to consider that in your plan, and whether or not that'll work for you, or whether or not it's an option. And I kind of already alluded to this, but when you're coming up with your plan as to how you're going to get back to work, you need to evaluate your technology. We had an issue. My firm is one of the biggest firms in the country. We have a lot of people that work for us, not just attorneys, but we have an incredible staff. We've got a lot of people using our system, and our poor IT team was busting their butt for the entire month of March and April, I think. We had a system-wide crash. Our technology wasn't ready for all of us to be working remotely. So please, 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 make sure your technology is up to speed for what your plan is going to be. Especially, I think, for a lot of you that are in healthcare, it's doubly important for you, because you're dealing with, privacy concerns. Are you going to be able to keep your patients, or, your guests, customers, whomever, are you going to be able to keep their information private in your new telework plan or in your new, remote work plan? That's incredibly important for you, and something that you want to have a plan for, before something, happens, before you've got some sort of data breach. But once you have your plan going, you need to get ready. It's still not I got my plan on paper, like, let's go. The next step is compliance and evaluation, and making sure that your plan complies with the myriad of laws that you need to comply with before getting going. To that point, I recommend that everybody partner with some sort of employee relations or HR professional. Of course, I will always recommend legal counsel for a number of reasons, primarily because we are dealing with this on the front lines with multiple employers in multiple jurisdictions, and also anything you do with your legal counsel is protected and privileged, should it come to that. But regardless, make sure that you are engaging with legal counsel or HR to review your plan before you put it into place. There's a lot of laws out there, and a lot of people remember a few of them, but maybe not all of them. Once you've done that, then you need to identify who your point person is going to be. I strongly suggest that you designate a person, a safety manager, a facilities manager, it can be an HR person, but somebody who can ensure compliance with this return to work plan that you've created, and the ever-changing health and safety guidelines that are coming out. This is not legal advice, but this is practical advice from someone who has dealt with employers, throughout their career. This person, your point person, should be a people person. A lot of times, safety managers, my husband's an engineer, his world is very technical, and their safety managers are not everybody's favorite person. Usually they're very dry and serious. There are so many reasons I could tell you why it's important that whoever your point person is on your COVID issues is a people person. From an optics perspective, it really just makes your employees and your guests and your visitors and your patients feel so much more comfortable. But from a legal perspective, I can't tell you the amount of cases where I step in and I see early on in the process where if someone had just taken the time to speak on a personal level with the employee, or with the third party, then maybe all of the lawsuit could have been prevented. So really think about who you're going to identify as your compliance and evaluation point person for your company. But then once you do that, you got to actually decide what you're going to do. You come up with your protocol for this person to implement and maintain. You want to look at a couple things. First, you want to look at the applicable laws. Oh my goodness, you guys, there are days where I'm literally, I even think I was emailing with Glenn and Allison about, oh yeah, the law changed today. Good question. You really need to look at both your state, local, and federal guidelines, but also any industry mandates that you might have that are controlling your reopening. It's not enough to just look at, the FFCRA, the Families First Coronavirus Act. It's not enough to just look at ADA or the CDC guidelines. You really need to do, it's kind of a pyramid, start at the top and work your way down and make sure you're hitting all of the regulations before you get started. And that includes OSHA laws. A lot of people kind of forget about OSHA in all of this, but we're talking health and safety. So OSHA is going to come into effect here. And actually, they have some great resources. So look at all the applicable laws. And then I think what a lot of people forget, what you want to do before you get started in opening your doors, is look at your HR policies and procedures. Are they, first of all, if they haven't been updated since 2017, let's get them updated. But also, does your plan, does it conflict with some of your pre-existing policies? because it might. Do you need to change some of your policies or your handbook? Or do you need to create some sort of, addendum or rider, or temporary policy in place as long as the governor's orders are in place? But really do a top-down investigation of what's going to control your plan. And then, of course, you got to look at the health and safety aspect too. You've got CDC and OSHA guidance on cleaning and disinfecting. If you need those, by all means, let me know and I can send them to you. But I'm sure you all are familiar with the use of hand sanitizer, hand washing, and PPE. PPE is a big issue that you need to evaluate. You need to evaluate whether or not you're going to have mandatory or voluntary use of masks, gloves, face shields. Obviously you need to comply with the law, but what is your requirement going to be? Is it going to be above and beyond what the law is requiring? I was telling Allison before we jumped on this call, I was in Utah a few weeks ago on a camping trip with my family. And because of the low numbers of COVID, masks are not required everywhere there. And it was jarring for me. I mean, obviously I just wore mine because, I came from a place that does have, higher incidence of COVID. But yeah, so not everyone is necessarily prepared for what the requirements are going to be. So you want to make sure that you know what they are and you're prepared for them. And that also means being prepared to pay for them. If you're going to require it from your employees, you do need to actually provide the materials. That's just how it is. My firm has all of the, they have disposable gloves, they have, the surgical masks available to all of their employees. And you're going to have to make that available too. And of course, if you haven't, and I think for a lot of you, probably the changes to your workspace that you need to make are probably just going to the online, or remote format. But consider the changes to the workspace that need to be made. But then once you do all of that, just to come up with your plan, then you got to establish it. Make your decisions about screening, which we'll talk about a little bit more in step 3. And also, now is the time to come up with your plan for what you're going to do when somebody reports either COVID symptoms or exposure. Not just your employees, definitely your employees, but also your guests and your visitors. We'll talk about that more in step 3, but now is when you want to have that figured out so that when it happens, you're already ready to go. Once you've done all that and you've come up with your plan, communication and education to your employee and the employees and the general public is the next step. And again, this is a critical point in your risk management, where if you get this right, you could either minimize risk for legal exposure, but also employee unrest. Okay, we did get a question about testing, and I'll get back to that. We'll address testing in step 3 because you should have a plan for that. That's a good question, and if I don't get to it, remind me. So as far as communicating your plan to your employees, you need to create a clear message about the organization's plans, both to reopen, but also your process, your new policies, how you're going to train your employees on what to expect, how you're going to train the public coming into your facilities on what you expect from them, and what their, the rules of the road for them are going to be. This is really, really important. And again, this is not just from a legal perspective, but also from a practical perspective. A really strong message up front is going to help alleviate a lot of people's concerns. People are nervous. They don't know what to expect. They're afraid for their loved ones. They're afraid for themselves. And if you have a really strong, heartfelt, positive, organized message about here's what we're doing to keep you safe and to take care of you, that's really going to go a long way, both with your employees and with the public. And unfortunately, part of my job comes with a dose of cynicism here, but that messaging that you have is going to become Exhibit A in any sort of lawsuit that you face related to COVID. We're seeing really enterprising plaintiffs' attorneys that are coming up with really interesting ways to use COVID as excuses to file frivolous lawsuits. And if you have a really strong, statement to your that's been public and is, made regularly about what you're doing and how you're staying on top of things, it can go a long way in shutting those down. But once you get the message prepared, what's important is that you prepare your managers, your supervisors. They need to be prepared with the information that they're going to need. They need to know the messaging, both they need to know the words, but also they need to understand the purpose. They need the messaging, and they need to know certain key information that will support their employees and help them manage the return to work. I recommend some sort of return to work toolkit, whether it's a checklist, a little binder, even this PowerPoint, something that they can hold on to so that when an employee comes to them with a question, they have an answer, or at least they know where to go for it. To be honest with you, I think a lot of the issues I'm seeing right now in the new kind of ADA type COVID cases that are coming in come from employees getting run around. Management doesn't know what their responsibilities are. They don't know what the options for leave are or what the policies are. And these employees are getting fed up. And honestly, I mean, I can empathize. Being an employee myself, these people want to know how the company is going to take care of them, what their rights are, and you really need to make sure that your management, not just one HR person in a cubicle, has answers or at least directions for these employees. That's really, I think, the most important part of this whole step one phase of getting back to work. But then, notify your employees, notify everyone of the protocol, and understand that this is an ongoing thing. Like, yes, your communication when you first open your doors or change, phases of public participation is going to be important, but the continuing conversation is just as important. So it's not a one and done situation. And the last thing, and I'll mention this a little bit further on too, but before you get back to work, consider waivers, especially those of you in the healthcare field. What do your waivers look like with your patients? Do we need to be addressing COVID? How about with your independent contractors, your subcontractors, providers that you might outsource with or for? What did those waivers say? And are you fully protected? Is it time for some new ones? Do you have force majeure clauses? Because if you don't, now is the time. But consider all of those before you reopen your doors or, before you start seeing patients in person. But once you've done all that, it's time. We're back in business. We got to get back to work and put our plan into place. Now, hopefully, like I said, I'll distribute this to those of you who want it. Please feel free to email me if you want a copy of the PowerPoint or the resources that support this information. I have posted some here. You're going to need some notices. The Department of Labor has some notices. The CDC have some resources that you can look at. But if you have less than 500 employees, you've got to put things up around the office, in the restrooms. You've got to put social distancing reminders up. I continue to believe that the interpersonal communication is the most important tool that you've got, but the notices are required by law, so you do have to put those up too. So get the notices up. And I would really recommend that whoever's putting them up takes pictures of them. You want evidence that you did put them up and where they were located and when. So make sure you've got some kind of evidence of that. And this is an ongoing thing. Things are going to change. Regulations are going to change. So make sure that, every now and then you're checking in on are your notices stale or do you need new ones? Go ahead and train your employees and visitors on these policies, both, what the notices, what the health and safety requirements are for your company, but also whatever your plan is, your safety measures, your rules. Make sure that your plan is properly implemented before you get started, and that both employees, and I can't stress this enough, a lot of times we forget about the public, but that the public also is aware of what you expect from them now that your doors are open in some respects. And just because, I think our focus is so much on health and safety, and we're worried about washing our hands, we're worried about face masks, but we also need to remember that we have other legal requirements as employers. um, Opening up the Zoom world, like, you guys are actually in my living room with me today. It made more sense for me and, my situation, to do my presentation from here. You have to be aware that you are possibly letting, the public into a more private side of your company or your employees' lives. And we still have to worry about things like harassment, discrimination. It's a new world, and we would be remiss if we didn't, recognize that there may come some new challenges from COVID that are not actually related to COVID at all, but are related to how we're returning to work. So, you need to be aware of that. I can't. My daughter has joined me. She's at school today, but she's joined me on internal company calls. But you might have to have some discussions with both your employees about keeping, certain things private when you're on Zoom, or when you're, working remotely with your patients or your customers. Or but then also, you need to have a set of expectations for your patients and your visitors as well, that doesn't just revolve around washing your hands. um, I've also, you've got to look at your job descriptions. You kind of have to relook at everything. Are people doing different things? Do you need to change your workstations around? Are your independent contractors actually subject to more or less control now, because of the changes of their job functions? These are all things that when you're returning to work and you're evaluating your workforce, that you need to continue to look at. It's a continuing evaluation. And I think the job description one's probably pretty important on, letting your employees know what's expected of them, but then paying attention to what you're expecting of them. Do you have someone who maybe doesn't meet the exemption category anymore and should now be an hourly employee? And those are all things that, as you're opening your doors, you need to start evaluating and paying attention to. I hope that all of you are imposing limits on travel and unnecessary in-person interactions. If you're not, it's something you definitely need to get in place. Now, there are certainly jobs where you need to have the one-on-one, in-person interactions, or you need travel. Whether it's, the job requires, I don't know. I have a quality assurance manager who, they're like, well, we need to go in and see the widgets in person. um, I'm not saying that you cannot do that, but what I am recommending is that you have a documented, keyword documented, detailed analysis of why that is the only option and why you could not offer an alternative. So that's going to be really critical in getting back to work. And then, you need to communicate that to your employees. Yes, I understand that travel right now is, scary. It comes with some risks. I need you to understand that we've analyzed it, and because of X, Y, and Z, it is still required for this position. Or, yes, I understand that, interacting with this population is challenging, but for X, Y, and Z reasons, the decision's been made that it's critical to our business that the interaction continue to be in person. Be prepared for those types of things. And this one's kind of a soapbox issue for me on a personal level. But of course, you got to remind both your employees and your people coming into your doors not to come in when they're sick. And let them know, like, if you've got XYZ symptoms, you need to stay home. But there's two things that employers need to do that I would say 90% of really fail. And as someone who works with them every day and defends them, it's really hard for me. And maybe it's because I am a mom myself. But first, you need to actually inform your employees when they're sick of the sick leave policy. So many times employees don't know what their rights or responsibilities are. So they are afraid to call in sick because they don't know what their options are. If you can educate them before they get sick of your expectation for them to stay home, but then also what their options are when they need to, they're going to be more likely to call in sick and keep the rest of your office safe. But the second one, and this is the one that's a little more personal for me, is then you have to walk the walk. And I'm willing to bet, since you're all here today, you do this already. But you have to mean it. When you say that it's important that you stay home when you're sick so you don't get other people sick, you really have to actually mean it. So many times I've been in, the back end conversations of, oh, well, this employee's been calling in sick a lot, or, they've had to deal with their kid a lot. And, the second you consider it, whatever your policy was about sick leave goes out the window. You have to say, yeah, you get 80 hours of sick leave. You're going to use it, and you're entitled to it. It's just build it into your workforce model. But if you're building in 100% attendance, especially in the COVID era, you're just buying yourself some trouble. So that's my part. I'll get off the issue, but you really have to have a good and honest sick leave policy, both in what you're offering, but then how you're treating the people who are using it. And I'll get a little bit more into the use of sick leave in our next step. But this really kind of goes into, in the second phase, how are you interacting with your people? I think this is a critical question. I've mentioned this before, but the communication needs to be regular, both with your employees and with the public. My personal spam email is full of emails from March when everyone was like, it's COVID, here's what we're doing, here's, how we're operating. It has been, it's still full because it's a spam box, but I haven't gotten a lot of those emails lately. I haven't gotten the, hey, client, or hey, patient, here's what we're still doing to keep you safe. Or, things are changing, but here's our new policy. I'd like to see more of those because I think that the ongoing communication is really important. Whether it's setting up just a regular, whatever, a monthly newsletter or a weekly email blast, that even if it's nothing new to report, at least that line of communication is always open. But you really need to keep the people who need to know informed about the actions that you are taking, continuing to take, and plan to take to deal with the coronavirus, but also to respond to employee and visitor feedback as this happens, and as we learn how to operate in this world. On that front, that communication, not every employee that punches a clock needs to be able to have these communications, but anyone who is really client or patient facing should be informed with the important information on business operations that they might get asked about. Not only the information, but how you're expecting it to affect your patients or expecting it to affect your employees. Again, I can't tell you enough how much, having a plan and a communication ahead of time before something becomes an issue really heads off a lot of bad reviews, unrest, loss of clients. It can make a big difference because it tells that person, wow, my provider, this company I'm dealing with is really prepared. They're really on top of it. And it adds a level of trust that you can't buy. So, make sure that your people are in the loop. It can be really easy to get lost right now, especially in the remote and teleworking world. So, just reach out. Hey, this is what we're doing. This is what's going on. Or even, encourage them. Do you have any questions? What's going on? Here, so-and-so, Jane Smith's going to be available for an hour on Friday to talk, or whatever it is. But make sure that interaction and communication is still going, and that it's not a one and done situation. And when you're thinking about your people, I'm going to mention independent contractors. I am willing to bet a lot of you have questions about independent contractors. I don't want this to turn into a diatribe on AB5 or any of the new legislation that's coming out. If you have questions about that, that could be its own presentation. So give me a call, send me an email, we can talk about it. But for now, at least when we're thinking about COVID and how to deal with your independent contractors, there was just a few things I felt like I would be remiss if I didn't bring up. So when you're dealing with your risks of COVID, we're still, if you're in California, you're dealing with your risks of, is your workforce properly classified? Now really brings in the question of what level of control are you allowed to exert on your independent contractors when we're dealing with implementing and enforcing health and safety guidelines. You want to make sure that, yes, you are allowed to say, hey, listen, these are our expectations, just like they are for any patient coming in the door. You are allowed to do that. But are you exercising so much control that you've actually eviscerated the independent contractor relationship? That's an evaluation that will need to happen, because you need to balance the level of, you need to keep your workplace safe. You need to kind of keep an eye on who's coming in and out and what they're doing. But also you do need to let your independent contractors be independent. So make sure you have that balance right, and work with someone if you're not sure, even if it's just to say, hey, can you look this over for me? But make sure it's right. And make sure that your expectations are properly spelled out. It needs to be crystal clear with the independent contractor, the nature of your relationship and the nature of your expectations, so that they don't come back to you when, business, because this is really what's going to happen, guys. Business is going to slow down for them. And if it's, if a bug gets in their ear, a plaintiff's attorney finds them, says, hey, you're having trouble getting unemployment, business is slow. Well, here's a way you could probably get a quick settlement from one of these employers you've been working for. You want to make sure that it's very clear to both the independent contractor what their role is and what your expectations are. And then also that it's spelled out somewhere, to prevent someone from coming back at you. I have at least one independent contractor case right now where they're saying they were improperly classified, basically because their work dried up and they need money. So you can get ahead of that. And when it comes to independent contractors, indemnification and waivers need to be solid. If you don't have them, you need to kind of work with someone to get them in place, because they can really be the difference between an employer or an independent contractor coming after you on an expensive wage and hour issue that you can't get covered by insurance, or them just kind of going about their business, and if things don't work out, then they go on their way. So those are some of the really important things when we're first getting back to work that we need to have on the forefront of our minds. But now the next step is, and this could be its own, this could be a day-long seminar at this point, but we move on to, okay, we got our plan, we're back to work. And now the inevitable happens. Somebody's exposed, someone's reporting symptoms, or someone has a positive COVID test. What do we do? The first thing is you've done your plan. You did step one. You're prepared to address your requests from your employees, but you also need to be prepared. This is California. Most of our schools are actually remote right now. Are you also prepared to deal with the people who not necessarily have COVID but have some sort of COVID related issue? Are you prepared on what you can and can't do for someone who can't work because of childcare issues or their own health and safety concerns? I've put some resources here for you, because you have to look at the EEOC guidance, you have to look at the ADA, you have to look at the Families First Coronavirus Act, you have to look at FEHA. I think you get my point. California paid sick leave, they just last week issued a new bill that expands leave to employers over 500 employees. There's a lot of laws is the point here. And you need to be prepared on all of them, so that when an employee comes to you, you already know what to do. there's going to be accommodations. No matter how big you are at this point, you're probably going to at least need to consider providing accommodations for an employee who's either in the vulnerable population or has COVID or is dealing with, having to a child who's got remote schooling that they're dealing with. Um, at this point, if you're in California, there's just, I know that certain workforces are exempted or carved out, but that's changing. So you got to be prepared for what happens when they get sick. And you need to engage in a dialogue with your employees. That's really what it all comes down to. In handling all of these laws, what I can tell you is you need to engage in a dialogue and provide reasonable accommodations to your employees. That's really the long and short of it. And how you do that is really simple. And I'll get to it in a minute. I did want to talk about, somebody brought this up, so I'll go through it quickly because I don't want to take up too much of your day here. But when you're worried about someone who's had exposure, you're asking yourself, well, what about testing? Can we use it as a preventative measure, or is it something we can only use as a reactive measure when somebody has reported having COVID? The ADA has said that medical testing must be job related and consistent with business necessity. The good news is the CDC went ahead and helped provide guidance that says if it's to, protect against COVID, then it is consistent. So yes, you can test your employees. You can require tests. OSHA is allowing for it as well. OSHA has always allowed for medical testing though. So you just need to make sure you're within their guidelines. But here are the basic warnings that I want to give to you if you're thinking about testing either employees who have been sick or are implementing a regular testing routine. You have to apply the policy uniformly. Whatever policy you decide to come up with for testing has to be applied to your worst and best employee alike. No, well, I don't believe that she was actually sick, so I want a doctor's note from her, but I'm not worried about him. None of that. You treat every employee the same with your policy. That is, step number one to implementing a testing policy. Second, no antibody testing. That has already been, the EEOC has already issued guidance on that. That will be a violation of the ADA. So you cannot do antibody testing. I suppose if someone wants to offer it up, that's fine. OSHA has always said if an employee offers it, that's fine, but you can't create an expectation. So, don't ask for it. And when it comes to, especially to the question about could I test my employees on a regular basis? Sure, but you need to be prepared to possibly reimburse them for the cost of the test and also compensate them for the time that it takes to have the test. That's going to be my recommendation. And the law backs that up. I mean, there's some question about, if they've been sick, could you send them to get a test and not have to pay them for that time? Probably. But I'm going to tell you that a best practice, especially if you're going to do an ongoing testing, is compensate your employees for the time it takes for them to get that test. And a note on testing, especially this really applies more to return to work tests and saying you can't come back to work without a note that says that you don't have COVID. It is falling out of favor. It's really more symptoms driven now and more inquiry based. Certain municipalities have even banned requiring an actual test before an employee returns to work. To be honest with you, that one's kind of a head scratcher for me, but that's the way the law is going. So, be aware that that should not be what you rely on in managing COVID. But what I wanted to say here about how you deal with employees that have COVID or are reporting symptoms is that this isn't new, guys. COVID is new, of course, but people get pregnant and go on maternity leave. People get sick. They have surgeries all the time. We've done this before. So I want you to feel less afraid and more encouraged that you can handle this. Yeah, there's some new laws and stuff, but really when you think about it, you've done this before, and both the employee and the employer have rights here. So, just because someone says the word COVID doesn't mean you need to throw your hands up and say, I don't know what to do. I can't ask any questions. Well, I don't want to know. You got this. You're going to follow your FMLA procedure. You're not going to go wrong following an FMLA procedure. The FFCRA regulations are a lot like FMLAs. You are allowed to ask questions. You can ask for a statement or description of the symptoms, of the facts regarding their condition. You can ask, have you had a fever? You can ask, what are your symptoms? Do you have, is it your stomach? You can ask those things because you need to know them. And the facts need to support the need for the leave. If someone wants to take a 4-week leave and not provide a doctor's note upon return, well, you have the right to ask questions, just like you would if someone needs, I don't know, needs 6 weeks off for a knee surgery. Because you need to know how to keep your workforce that's in the office safe. You also need to know how long to expect your employee to be out and how to accommodate them when they come back. So we have a roadmap here, guys. You can ask some questions. And so, if you keep any slide from this whole presentation, keep this one, okay? Because this is how you're going to handle it. And then, this one's probably good too. Some of this goes to contact tracing, because are these questions that you're asking, you're worried about, am I really invading my employees' rights here in asking questions? And the answer is not necessarily, because not only are you worried about that one employee, but you're worried about the rest of your staff and the rest of your guests, patients, visitors that you're responsible for. So to that end, you should, if you don't already have a contact tracing policy in place, you should definitely work to get something going. You should keep track of your positive cases from both your patients, your visitors, and your employees. You can do temperature checks. That's something that you can document. If someone's got a positive test, you can keep track of it. And when it comes to someone who has either reported symptoms or reported a positive test, you can ask them questions about who they come into contact with, how they get to work, who they live with, what they do outside of work, to the extent that it could expose them to COVID. Where do they go? What grocery store do you go to? What community? Those are all really important questions, not only for your administration of their medical leave, but it's also very important towards helping you stop the spread of coronavirus and notifying those people who might have been exposed. So they're questions you really have to ask. You just need to make sure that you're asking them in the right way. But when you are asking them, I think all your questions are probably, well, how do I keep things private? And the key indicators, the key things that you need to know are, none of this should be kept in someone's personnel file. It should all be kept in a separate file. You cannot release the names of employees who test positive, especially if you're going to do a routine testing policy. This becomes even more important. You can't release the names. So if you need to redact names, if you need to kind of scrub the documentation, use employee ID numbers, those are all really good ways to deal with it. But you've got to, the California Medical Information Act is going to apply. Now that said, and people always ask, you do need to tell people if they've been exposed. What you can do is identify someone who worked on this floor, someone who worked in this department, someone who was in the office between these dates. If they figure it out on their own, that's fine. If they figure out that, well, Sally at the front desk hasn't been in for the last 2 weeks and they said it was someone in the front of the office, you're not violating their rights by telling them that. You're giving them information that they need to take care of their own health. But you do need to keep the medical information private and separate, even though you are allowed to ask for it. And you do need to keep the names protected as well. And there's one more surprise. The California Consumer Privacy Act, they had enacted it earlier this year, in January, and it went into enforcement in July. if you are going to do any sort of contact tracing or collect any personal information on your employees, you actually need to give them a CCPA disclosure on what information you're keeping on them. So I don't know anyone who's doing that yet. I'll be honest, when I restarted with Louis Brisbois, I looked at their paperwork and said, hey, you're actually missing a CCPA disclosure. I guess that's why they rehired me, is because I was able to pick that up. But if you're going to start collecting medical information, guys, you got to have a CCPA waiver or notice to your employees. So really, at the end of all of this, I guess everyone's question is, where do we go from here? And listen, if I knew, I probably would not be punching a clock if I had a crystal ball. But all I can say is, for now, you just need to be considerate. You need to think about who your people are, where you're operating, and where you're at right now. You need to evaluate. You gotta change is constant, guys. You gotta evaluate what changes you should make or which ones could be permanent. Google. I think Google just went remote, and I think even gave people Fridays off. The workforce is changing, and should yours be one that is changing too? Like I said, this isn't a Ron Paul Peel commercial. You can't set it and forget it. You might have to check in, set periodic reviews, because this isn't going away. It's changing, but it's not going away. So we got to deal with, we might have to check in on our policies and evolve with it. And your document retention policies now more than ever are critical, both for the privacy protection elements and also as your line of defense in the new world of lawsuits we're facing related to COVID. But I've hinted at this, but don't forget that you just don't get tunnel vision, guys. COVID is just one issue we're facing. It's California. We've got new things coming our way every day, and we got to stay on top of it all. And if you need help and you need resources, they're out there, and there's people like me in the world that will help you find them. You just kind of got to remember that you've got a job to do and people to serve. And, every day you just got to check in on how you can best do that. And that's how we're going to get through this. So, that's it. That's my spiel, guys. If you have questions, I've got time. You might be busy, but I'm happy to answer any questions you have. If something comes to you later, here, my information's right here. You can find me online. You can ask Allison. I try to be pretty responsive. I hate admitting this, but my office line goes right to my cell phone. So if I'm available, I'll answer. If I'm not, I won't. You might hear a screaming 2-year-old, but I try to be as available as I can for my guys. So anyone have any questions?